that does not also mean that a pharmacist cannot also do the job of a pharmacologist, because a pharmacist is also a pharmacologist. Do you get? Because when you study pharmacy, you are studying pharmacology also. So as a pharmacist, you're a pharmacologist. But as a pharmacologist, you are not a pharmacist. So in conclusion, we can say.
All right, when I saw this video, I commented. Oh, I tried to explain to her, but she was not accepting it. So I just want to make this video because I'm very sure that there are other pharmacologists, there are other people studying pharmacology, but seeing this post now, they will not feel like pharmacology is really not important, because she said that every pharmacist are pharmacologists, but that is very, very, very wrong. Studying pharmacology in school does not make you studying pharmacology as a pharmacist in school does not make you a pharmacologist because of the level of exposure. Number one, something that someone studied. I took one thing and I studied it for like 4 years of my life. Then you took this one thing, including other five things, and study them for 5 years, which means that one for 1 year, if I'm not mistaken. So, do you think that something you studied for 1 year or something you studied for 2 years, you can edge someone who studied it for 4 years? While studying pharmacology in Delta State University, Abraka, I studied medical biochemistry, I studied anatomy, I studied physiology, I studied my medical biochemistry from 200 level till I graduated. But that does not make me a medical biochemist. There is no question, if I'm not mistaken, also, let it not be I'm being proud, in the BSc level, not masters. There's no question in the BSc level that you will bring for me that I cannot attempt in medical biochemistry. But that does not make me a medical biochemist. So you studying pharmacology as a subject or as a course whilst you are in pharmacy school, does it think it automatically makes you a pharmacologist? First of all, you should ask yourself the level of exposure you have. Your level of exposure, it matters. Who are pharmacists? There is a way a pharmacist sees something, and there's a way pharmacologists also see something. It's called terminology. Now, who are pharmacists? Pharmacists are health professionals that are responsible for dispensing medicines, advising patients, and ensuring safety use of medicines. Then who are these pharmacologists? Pharmacologists are scientists that studies the interaction between drugs and biological system or biological organisms. Now, you see that you see that pharmacology is talking about drugs, pharmacy is talking about medicine and medications. Pharmacology is not really interested with what you are using the drug for. Pharmacology is interested in what this drug can do to the body and what this body can do to this drug. While pharmacy, their major concern is how to use this drug. I've been in the midst of pharmacists when we are discussing. When I'm talking about drug classification, drug mechanism of action, drug interaction, these guys, like we are just talking randomly, and I noticed that they focused on how they can use drug. We are talking about is it not what's this drug? We are talking about diabetes. We are just talking about diabetes, and I went straight to drug classification. These guys went straight to how they can treat it, how they can manage it. They're talking about insulin, how they can use insulin, the level of the level of glucose before they can introduce insulin. You see that our knowledge differs. Let me show you an example of a pharmacology question and a pharmacist question. This is a pharmacology question, and the answer is very simple. And they are the same. They have the same answers, the same meaning, but listen to the terminology. A pharmacology said, describe the signal transduction pathways involved in beta adrenergic receptor activation. Now listen to pharmacy. How do beta blockers help to control hypertension in patients? These questions, they have the same answers, but you see that the way these questions are being asked are different. So I just want you to know it, that being a pharmacist does not make you a pharmacologist. If a medical doctor studied pathology and pharmacology, a medical doctor studied pathology, does that makes him or her a pathologist? Ask yourself that question. Because the level of exposure, I studied medical biochemistry, I studied microbiology. Do you think I'm a microbiologist? If a microbiologist is talking here, do you think I will understand what they're saying? So don't judge yourself based on the BSc knowledge you have in pharmacology, saying the same thing as pharmacy. Ask your professors. You don't know better than those who distinguish these professions. Before they pharmacology are not even those that had pharmacology where I studied. My pharmacology, my department was not under pharmacy, because I was even having this issue when I saw that there are some courses. I was doing some anatomy courses and physiology. So I was like, why am I doing this when pharmacy are not doing this? They should take them away from me. But they said this is pharmacology, not pharmacy. Study what they give to you. So you see, the level of exposure, things that pharmacologists know, when it comes to research, when it comes to discovery, read my lips, no pharmacy, no pharmacist can edge a pharmacologist. When it comes to research, I'm not, see, don't be judging yourself based on your BSc knowledge in pharmacy. Before you just do your whatever you do in pharmacy and come and tell me how you can edge a pharmacologist when it comes to research in pharmacology. Now, a pharmacologist is talking about research, then you are talking about your clinical practice. You think you can edge them. They are not the same. Listen to this story now. Two persons opened a shop to sell to the public. As they are selling, their goods were running down. One of them said, okay, be at the shop, let me rush to the market to buy more. So instead of us closing our shop, two of us should just go to the market. No, one person should remain, keep selling while I go to the market. The person that went to the market to search for and bring more drugs is the pharmacologist. Why the one selling is the pharmacist? I believe this is very, very simple to tell you that they are not the same. Before you can go to that market and buy what that person is buying, you need someone to take you there, direct you, and show you where they used to sell different drugs, different paracetamol. This is very simple. So before you also as a pharmacologist can come and be dispensing and be selling to people, you will need someone to train you, teach you before you become a pharmacist. The reason you people see pharmacists to be bigger is because they have more opportunities in Nigeria, not everywhere. In Nigeria, because Nigeria it's like a consuming nation. Nigeria they just consume. They don't do research. They are not interested in research. Bring and buy them. You know that there are some drugs that they are using or that they are not using outside the world, like outside Nigeria. But if you bring them into Nigeria, they are very, very useful. Do you know that? So Nigeria, they are not doing research. They are just into bring and make we use them, bring and make we use them. That is Nigerians mentality. So being a pharmacist does not make you a pharmacologist because you studied pharmacology in school. That is what that's just one thing that is keeping me here. And if you are studying pharmacology, don't think you can go and be doing the job of a pharmacist. You are studying pharmacology. The strength of a pharmacology, of the strength of a pharmacologist, or the strength in pharmacology is research, discovery, drug development. That is what that is where you edge the pharmacist. Then you as a pharmacist, just sell your drug, jejeje. Stop trying to say you know better than pharmacologists. My sister, I will advise you to ask your professors, ask those that taught you because you were not grounded. Yeah, you are not properly grounded. You don't really know who a pharmacologist is. I know you might say, okay, if really pharmacology is the way you are praising it, then why are you studying dental surgery? I was working as a pharmacologist when I discovered a particular area that I'm interested in and is lacking in Nigeria. It's lacking in our society. I noticed that this dentistry even affected me. So I decided to go and study it, not because I don't love pharmacology. And I'm hoping that after the dentistry, I'm coming back to master in pharmacology. So I love research and I love discoveries. I love innovation, scientific innovation. That's exactly why I'm coming back to study pharmacology. So get it and get it clear. The fact that you study something in your school does not make you a professional in that field. You are only having a tip of the knowledge, but not the complete. If you think I'm wrong, bring the pharmacist. Let's talk professions by professions. Like let's speak in our language. Then you will know who a pharmacologist is and who a pharmacist is. Then you will understand their difference. Because the idea, the brain, the knowledge, the foundation. There are some people who studied pharmacology and toxicology. I believe that's what pharmacists are studying. There are some who study pharmacology and therapeutics. There are some that study pharmacology and pathology. So this pharmacology is everywhere, but trust me, the understanding of these people are different, are totally different. Are you getting me? So a pharmacology is a behind the scene course. We all know that. It's a behind the scene course. But trust me, they are great policy makers. When they discover and tells pharmacists, they comply. So pharmacists, I believe you people also have the research knowledge. But trust me, the research knowledge is in pharmacy, not in pharmacology. The method, the techniques that pharmacologists will use differs from what you think you know that you will use.